With the FDA coming out a few months ago and updating the status of hormone therapy or some specific types of hormone therapy and the risk of breast cancer, among some other things, we've had an influx of patients who are either very young or beyond menopause to initiate hormone therapy. And so just as kind of a reminder, our practice is really indicated for women 40 plus. And that doesn't mean that there's a hard stop on 40. There are some women in their 30s who have had a total hysterectomy, for example, or they're in menopause for other medical reasons, or maybe they're having some sort of sexual pain or libido issues. But generally in our 20s and 30s, there's not a lot that we're doing from a hormone standpoint. And so coming in to just have hormones tested is not really what the purpose of this practice is. We're going to focus more on perimenopause and menopausal women. And then for the women who are in the older range, so the indication for hormone therapy is generally to start within 10 years of menopause. So that usually puts women in their early 60s, the cutoff. And so when we get women who are in their mid 70s and 80s who are coming in who are wanting to initiate hormone therapy, that really is not indicated. We have to make sure that we're maintaining safety for our patients. And so we are not going to be initiating hormone therapy in women who are generally past that early 60s mark. There's not a line in the sand that we turn 60 and you don't have the opportunity to start hormone therapy. But we're looking at risk versus benefit and all other medical conditions to make sure that it is something that you qualify for. So I just don't want patients who are 75 coming in and getting upset or disappointed that we can't start them on an estrogen patch. For example, there are other things we can do for vaginal symptoms or pain that they may be having, but starting systemic hormone therapy at that time is not indicated.